डन सर।
ठीक है, बंद कर दो। Hi everyone, I am Dr. Sourabh. So let me know that if I am visible and audible. Alright, I think should be okay. Just let me know. Just let me check again. Alright, so I'm Dr. Sourabh. So let us see about my subject, ophthalmology. Congratulations to everyone who have secured a good rank in this NEET exam 2024. And first I will just give an overview about my subject and then I can take the questions as well. Hi everyone. So I will just turn on the chat. Alright, so again good evening. So what are the options after doing 3 years in ophthalmology as a resident? One is, of course, you can have a direct job. Now some people think, sir, I'll just give an overview and then I'll take one by one. Alright, so one is option joining a job directly even after a post-graduation, and it's not difficult. You can get a job. After a job, after a residency, everyone asks, so what is my pay scale? First question is like that, sir, what is my pay scale? So after 3 years of residency, the pay scale is every specialty has a similar pay scale after 3 years. Maybe around 1 lakh per month, but except radiology and maybe anesthesia. I'm talking after 3 years. Now after 3 years, all depends on you, not the specialty where you want to take up. If you want to do fellowship or not, if you want to do SRship or not, or any other thing that you want to do. I'll give you the different options. So after that, an individual is responsible for himself. So after 3 years, every subject will give a same pay scale. Many people, of course, attend this to know the pay scale, but that depends on you actually. After 3 years, everyone will have the same thing. After that, it's one on you, unless and until you have a family history, of course. Second is fellowships. Fellowships and as a senior residencyship is almost similar nowadays in ophthalmology. Many institutes have a fellowship of different durations. Means I'm talking long-term fellowships in specialty like cornea, retina, glaucoma, pediatrics, ophthalmology, squint. Third option is many people can go into research as well. PhD is one option which is less explored in India, but that is also one of the options. Or those who want to go into medical colleges. Like in Delhi, 3 years post-residency is also required, but in many states like Maharashtra, it is not required. Straight away after your 3-year residency, you can have a lecturership in a medical college, and then you can grow from there. Yes, other option, Shreyans, is own private setup. Now, own private setup, of course, I'll take about that. It is not necessary that you build a 1 CR clinic and a 1 CR hospital on the first day. Nobody is asking you. It is a very common misconception that ophthalmology setup is very huge. So who is expecting you to have such a big setup on the first day? You can have a setup like a medicine, MD medicine, a clinic, a small clinic. Of course, slit lamp, 3 to 4 lakhs rupees slit lamp you can get. Also, you can get a refurbished one as well. So similar setup like a medicine, people have a setup like a clinic you can have, and then you can have attachments to various hospitals for surgery. Nobody is asking you to buy all the so-called equipments nowadays. So many investigations like angiography, OCTs, optical coherence tomography on the first day. Of course, when you build up, then you will slowly build that as well. But don't take it as a misconception. Your 1 CR is required for own private setup. That is very, very wrong. If someone wants to get into a private setup, he is confident that after 3 years he is able to do surgery, he is able to manage patients, then nobody is asking you where have you done your residency from. Now this is very less explored. MBAs into pharma companies. I have many of my friends who have gone into them from AIMS, but that is very less explored, but depends on one individual because that's purely non-clinical side. and maybe you have taken ophthalmology if you have a mixture of medicine and surgical. So that is just an overview. Yeah, I'll talk about that as well, Arun. Now let us go step by step, right? So job after 3 years, you can get it. It's not an issue. In any city of India, you can get a job after 3 years of residency. But the options will be more widened if you do a fellowship, particularly if you want a job in a top tier city. Now in a 3-star city, even if you are doing in 3 years of residency, then you will get a job. And fellowships, of course, anywhere if you are doing a fellowship available in cornea, glaucoma, retina, oculoplasty, uvea, squint, oncology, of course the prospect will be more. Particularly if you are in capital cities, top tier cities, then fellowship is particularly needed. Fellowship, or when I say fellowship, I mean senior residentship as well. Alright. Now I'll take about the seats mini at the last. Now what about this private setup? Of course they require capital, but I have said that you can start from a small setup. Now after 3 years plus 2 years of fellowship or 3 years of senior residency you can do, then you are capable enough, you have a good surgical acumen, or the short-term fellowship. Cataract is one which surgery, many people, is one bread and butter of ophthalmology. So if you are well versed in cataract surgery, then you can start, even after 3 years you can start your own setup, and you can start up in a very small setup like a normal clinic of a MD medicine. MD medicine people say that, I heard Dr. Arvind saying that medicine people are like a cockroach. They can sustain anywhere. In a jhuggi also they can sustain, in a 5-star colony also they can sustain. So we are also like that. We are somewhat like kachua, tortoise. Slowly we grow. But sometimes we can sit on a frog, sit up on a rabbit also and jump very fast, because once your setup is flowing, then in surgical field nothing can beat that. Okay, so that is one thing, that don't get worried about the amount of capital which is required. You can always start from a small setup. Ramit saying that everyone says that you need to be so precise with eye surgery. Of course, you have to precise with any surgery. Any general surgery you don't have to be precise with. And particularly in eye, of course, I'll take care that you take a steep learning curve for that. So that is what the pros and cons I will take with. First, see, it's a concept based learning. If you want to have a knowledge based serving to the society, it requires a lot of concept. You must have realized during your MBBS also. It's a very concept based learning, and that will continue. That was just the basics of ophthalmology in the UG. Now everything will be one step higher what you have learned, because that is a subject will be for you for lifelong. So it's knowledge is not the end. I myself keeps on learning daily. So it's a mix, and it's a mix of medicine and surgery. Some people say that I don't like the surgical part. Doesn't matter. There are a lot of medical retina which is also going on, like medical field is going on. Glaucoma drugs are medical, then medical retina lasers are there. So many lasers are there, intravitreal rejections are there. They are procedures, they are not surgery. So even if you want the medicine part of ophthalmology, that yes, of course during residency you have to do some surgeries. You will learn surgeries, but maybe in later in practice you can go with medical retina. You can go with the medicine part of the ophthalmology. So that is also one thing you can take care of. Patient satisfaction. If you do a liver operation, patient does not know what have you done, liver transplant or heart transplant or kidney transplant, whatever. How does he know? उसको तो पहले जितना था उसको वैसे ही same situation, particularly he is having some pain also post-op. But in this, the first post-op day, the patient gets a very good vision, and that is patient satisfaction, and you will be satisfied when the patient is satisfied, and that is instant. Even in first post-op day, you can feel you have done some wonders to the patient. So that is one very, very big thing in ophthalmology. And plus more is a very fixed as well as flexible. It depends on you. You can have a 9 to 5 job, even in your own private setup. Nobody is asking to work 12 hours. It's for private setup. You can have a fixed particularly, and if you are in a job, that is also fixed hours, 9 to 5, 9 to 6. But it can be flexible also. Those who want to work, like for example, you did a 3-year residency and you did a fellowship. Now you want to work more, you can have freelancing in various hospitals. So it's a flexible thing as well. So that all depends on, that's why INICET after 3 years, everything is on par. Every specialty is on par. After that, where you want to take yourself depends on you. If you have a easy go lifestyle, have a fixed job. No, particularly no emergencies are there. Na? There's no emergencies in ophthalmology, very minimal emergencies. In Diwali time, some injuries are there, Holi time, color, and acute angle closures, acute incidences, corneal ulcers are less. So, and everyone will not come to you, right? So, it is fixed and flexible working jobs. Emergencies, as I told, are very minimal. And no one can do cataract surgery. No one else can do eye surgeries. No ENT medicine. ENT versus medicine, they fight in respiratory medicine, and ENT they fight about this throat. The obs, gynec and surgery people, they fight for hysterectomy. Nobody can fight with us. So there is no cross reactivity. No other specialty can treat eye patient. That is one thing. And yes, very minimal setup will be required, and you can become an independent entrepreneur. Trust me, you don't need to have a very large setup to have a basic setup. You can always attach, like a general, I always say example of a general surgeon. General surgeon doesn't, you don't ask this question to general surgeon that are you having your own OT? No one has an own OT. They are attached to the hospitals. You can, in ophthalmology, you can be attached to the hospital. You can have your own setup as a private setup, or you can join some place. At the evening, you can have own setup, and then you can attach to different hospitals for surgery. So you are an individual entrepreneur in this. And lot of innovations. This is one subject in medicine which has a lot of innovations in the recent decades. That's why it becomes costly, because if you buy some sophisticated device, and that becomes costly, but you don't need them initially. As you grow, then you can buy them. And there's a lot of achievement going on in innovations, and it will go on in ophthalmology. I know about that. Now the cons will be yes, RN, it is a steep learning curve. And if you have actual tremors, you should avoid. One, you should avoid if you don't have binocularity and 3D vision. You should avoid any microsurgical field. You should avoid if you don't have a good depth perception, because you're working all the time on slit lamps, that is requires binocularity. You're working all the time in operating microscopes, that requires binocularity and stereopsis. And yes, it takes it's a microsurgery, it takes time to learn. It's not on the first day you will do all the steps. So it is step by step. Even in AIMS, all the surgery is not given. Your seniors will teach you, your teachers will teach you step by step. Maybe starting with suturing, you do suturing practice, and then incision, then capsular access. So step by step it is done, and everyone learns. Don't worry about that. You will learn about that. Second, very misconception people ask, I am a very high myopic, high astigmatism. Sukalita Malik is asking. There is no problem in that. I have in my Singapore fellowship a Singaporean ophthalmologist, one of my fellow batchmates was having -10 number, -10 with high astigmatism. He was now he's a consultant there, so you don't have to worry about that. That is not a problem unless and until you have a binocularity. Just Ramneet, I just answered this question. Now, if you have a high myopia and retinal detachment and the vision is less, vision is lost in one eye, then you don't have stereopsis, Ramneet. Then of course it is avoided. Cost of own setup, I told you can start with a small, but as we grow, of course you have to buy some more devices for the investigations. That cost is this, but you can't start with a simple setup as well, and then you will realize when you do surgery you are gaining a capital so that you can build up on that capital. Everyone does like this, unless and until I say there is a family history. Family history, you understand, no? Your mother, father is ophthalmologist, you have already have a hospital, then it's cakewalk for you. Still not cakewalk, at least little better from rest. Then it's a separate scenario. Now, and hand-eye coordination is required. That's why I said stereopsis, 3D vision is very, very important. Okay, now How to decide? Yeah, Ravikram, I'm coming to that. How to decide the specialty in ophthalmology? So, I mean, there was a survey which was done. Actually, the survey was done in every specialty. I will tell about my specialty. That ophthalmologist was first choice in very few. And these few might be about 10%, might be having their parents are already ophthalmologists, or those very less, those who actually want as a first choice, they, as a subject in the MBBS, they feel no, I have मेरे को तो यही लेना है subject. No, ऐसा, this is not the case. Even in my, very few people have this. Even I didn't have my first choice ophthalmology. But at the end of MBBS, what I always say, आपको ये पता होना चाहिए, this you should know, it is medicine versus surgical field. At least you want to know this, whether you are made for surgical branches or medical branches. This should be clear at the end of MBBS. Now, if you have a confusion with the medicine branch with the surgical branch, then you think you have to clear your mind at which inclination you are with. So mostly ophthalmology is second or third choice specialty. And who decides? What decides? One, of course, these are the features, and this is all in your mind. How much cost, how much I will earn, what is the quality of life, work-life balance, intellectuals. These are the things which were taken in the survey as well to know about the ophthalmology per se in my subject. So mostly the second and third choice ophthalmology is always in the mind of the people. All, of course, depends on your rank as well. How not to decide a specialty is more important actually. That you want a specialty which is easy, it is not. You have to work in every specialty. In ophthalmology also you have to work. Maybe not in residency, but if you want to earn more, you have to work in every specialty. So this should not be the case. You want to earn a lot of money, then that's why you're coming to a surgical field. That also should not be a case to decide of any specialty, because as I told you, money can be in any subject. It depends on you. Like if mother father is ophthalmology, you are taking ophthalmology, yes, of course you will be forced to take, but you should listen to yourself. That also should not. And what about prestige? So prestige means I was impressed with someone during my lectures or during MBBS. I like this person, he's an ophthalmologist, I will also take that. Or he's ortho, he's a medicine, I will also take that. That also should not be the case. And last, of course, this should not be the case. In ophthalmology, you think that a lot of girls are there and young males. You think that I'll go to specialty like this. Please don't decide on ophthalmology based on this pre-assumption. That is absolutely wrong. So many males are there in ophthalmology, more than females, I guess, nowadays. Alright, now, what about this MD, MS, DNB, DO? So I'll take DO first. Okay, DO nowadays very few are there, and because they are being converted into MS. Now, if you are doing for example, your rank is very behind, and you have to take a specialty that is DO, then 2 years of diploma should be followed by 2 years of secondary DNB. Otherwise, don't take. If you are okay with that, then only take DO. Now, MS, MD. Now, when I say MD, see, MD is why I take MD, because MD, this is my is MD degree. In AIMS, ophthalmology is given MD degree, because they follow, I don't know US why they follow like that. Everywhere it's MS degree only. So if you have a MS MD degree, yes, it is better than DNB, but there are very good institutes like superlated DNBs like Arvind Hospital. LV Prasad has stopped DNBs, I know now. So LV Prasad was there. Now Shankar Netralaya, Arvind Institute, Shroff Charity. There are many others which have good residency as compared to MS from peripheral institutes of peripheral cities in various states. So if your rank is like that you are not getting the top cities of the state, then your DNB superlative institutes, if you are getting, don't get disheartened if you are taking DNB, because it doesn't matter at all. DNB and MS candidates, there is no discrimination even in exam, no problem in passing rate of DNB. Like students must be asking this, no problem. Even getting job is equivalent for DNB and MS. There is no issues at all. Even if you want to go to fellowship, no problem. Job opportunities, no problem. Passing rate of DNB, no problem. It depends on you. And private setup is absolutely doesn't matter at all. If you're doing a private setup, your own, doesn't matter. Nobody is going to ask you, you've done a DO, DNB or MS. So it doesn't matter at all if you're doing DNBs. And good DNBs, like which I'll mention later on, they are actually better than many of the MS in our country. But one caveat is there: if someone is looking for a government job, now government jobs are less, but still if you're looking for a government job, in that they prefer MSMD over DNB. Yes, that is the truth. They should not, but that is the truth in a government college. So if you are want to go to government college, then MSMD is preferred over there. NEET PG, your question is what is the cutoff of DNB good institutes? That depends on a lot of factors. What is your rank? Which institutes, main cities you are getting or not? Third, which DNB institutes, the superlative ones, are available on that or not? Even they have taken 5,000, 4,000, they have taken LV Prasad initially. Now Shankar Nethralaya is even a good institute equivalent to that. And DU, as I told you already, you have to do a DNB afterwards. Now how to decide an institute now? Ravi Kiran, that was the question. What specific thing you have to look for a college or hospital before joining it? See, that is one's independent choice. That is my choice. That if I want to do a post graduation, like I chose by myself, I got in AIMS. It was only AIMS Delhi then. But even if I have not got in AIMS, I would have chosen to do a residency from the city, from where is my home, and or where we are going to settle. If you don't know where you're going to settle, at least in your home city, because that will give you a lot of benefits of visiting or maybe staying at your home, have a home food. Some people, some don't like to go into a hostel like that. So a lot of ease is there, particularly, and if the patients which are coming to you, and after that also you are settling in that city, some patients know you already. So that gives a very good perspective if you do from your home city, but that's an independent choice. That is my choice. It may or may not be yours. Now you have to choose. You should choose a hospital which offers SRship, senior residencyship, and fellowships. The reason is because after 3 years, if you want to enhance your skills into various specialties, you have to look for those hospitals which are offering the fellowship, because chance of getting the fellowship is much better for those people who are known by because there is no NEET PG like that exam. There is no exam unless there is a PGI SS exam only in PGI. 1 or 2 seats are there only PGI. That is also nothing but they were senior residencyship. Now they have changed the name to fellowship, and they have given written an all India exam for that, only for the PGI. There is no MCH as such. They have given a name MCH and PGI, but as such there is only 1 or 2 seats. That is only senior residency which has given the name of a fellowship. So as per fellowship, there is no pan India exam. What is there? Different institutes have different exams of their own. Exam means they can have, some have only interviews, some have a baseline screening MCQs, and those who pass for a minimum, and then they are called for the interview. Interviews are the must. Everyone takes an interview. Some have only interviews. Now bond is the one which is very important. So 1 year bond is no issue at all. If you are into opthal in that bond, that is no issue at all. But places like Kolkata, RAU Institute Kolkata is a very good institute, but it has a 3 years bond. So that depends on individual whether he wants to spend 3 years, because after 3 years, again you want to do fellowship, then it will be a long time. So this bond thing is individual choice whether you have to see that or not. 1 year bond, I think 2 years is also not a bad thing, but if you are doing something in the opthal in that 2 years, not doing any medical officer job. Talking to current residents is also very important. I have made each and every state, I have talked and I have asked various residents who are in my course, and they have given me a list. Actually, I have talked to them, they have given me a list that this is the top college of my state, including MS and DNB. I will share that with you as well in a while. Now academics is always better over number of surgeries in residency. That is one thing which I believe you should look for an institute, because if your academics, you are only going to study in the 3 years of residency. After that, your most of the time is spent on surgery, number of surgery. If you think only a decent number of surgeries is okay in residency, don't go for the number of surgeries. because surgery you have to do lifelong, and as you go you will become more and more better. If you only 3 years, see, only 3 years of surgery, if you think I'll do a lot of surgeries and then I'll be okay. No, I think academics is the one. With thesis everyone has to do, publications, academics is the one, because that will help you in getting fellowship, and in fellowship and SRship then your surgical skill will improve. So decent, I'm not saying don't do surgery, decent number of surgery, or just get inclined to microscope, inclined to surgery, some surgeries, know what are the surgeries being done. Academics is the one which is very, very important, because after the 3 years you will not study. I know that. So these 3 years are the last, just remember, these 3 are the last 3 years which you are actually going to study, because you are giving an exam. You have to give a passing theory exam for DNB or MS. So that is why 3 years are very, very important for the academics. Now, if one is thinking of fellowship, like if you want to settle in a top tier city, second tier city, then right now today's scenario is fellowship or senior residencyship is required. So you should prefer academics over the surgery in the residency. So choose that hospital which has more academics. If you have choice of both, I would prefer choose academics better. Like for example, I'll give you example in UP, KGMC and Allahabad. Allahabad has a good surgical cutting, less academics. While KGMC Lucknow has a good academics, less surgery. I will have gone for Lucknow because I will think of fellowship after residency. But those who directly want to go for private setup, that will not matter. Then your surgical cutting skill should be important. So then you prefer surgery. For example, there is a RIO Sitapur. I will mention so many times. So many surgeries are giving. Sadguru, Chitrakoot, so many surgeries are giving. Academics very less. Sitapur is still a regional institute. Academics are okay, but so many surgeries are giving. So if you want to do only surgery after 3 years, you take that. No issues and all. And very minimum academics are there. Doesn't matter. In private sector, nobody want to know where you go from. So if you are going from after 3 years, you want to do only private setup, you prefer that. I mean, yeah, academics, of course, many would have, you would have known, or many have told in DAMS there is a residency course. I have a residency course of my own, and so many students have already are a member of that. 3 years I've been doing this course. If you want to know about that, if you're taking ophthalmology residency, and you can just WhatsApp or Telegram on this number. Now I'm going to take you to each and every state, okay, and your questions. Now each and every state I have talked to the residents. This is after my own thinking, and I am talking to the residents, and they will give a list of including DNB and MS. So I have some time, 20-25 minutes, and then I'll go each and every state, and in between I will take your questions as well. Kajol, I don't like MS from private hospital colleges like in South, like in Manipal, in Hubli. There are various good colleges, but I don't suggest taking from private, because the fees is very high in that. So that is a deterrent for me. I'm not saying it's not good study over there. It is my individual choice. So that, because that fees is there, so that is an individual and a family decision whether to go into private or not. But if you don't have any other option, but you can go with that. Yeah. Amrita, I told you about diploma already. If you are doing for diploma, you have to go with secondary DNB. So Delhi colleges, no doubt in that. Maulana should be the first one. If you are getting that, it's excellent. All over India, the first choice should be Maulana Azad. Then in Delhi, I'm talking about UCMS, Lady Hardinge. Now, Sourabh Charity, if you are getting, the Sourabh Charity Hospital should be over Lady Hardinge. The simple reason is they offer fellowships, and if they know you are doing well, they will offer you fellowships, and then your life will be set. If you are doing DNB from Sourabh Charity, not private, DNB from Sourabh Charity and fellowship from that. Then Lady Hardinge. Then all these Gangaram, DDU, St. Stephens, Northern. Gangaram is a private, rest are all government. So this should be much above this Center for Sights and Permanent, eye care shop. These are private. Choose these private only when you are not getting anything else, because they are private setups. Private setup, you know, na? It's, I mean, The surgery will be very minimum, academics also will be very minimum. If no other option, then only go with privates. Otherwise, DDU sensible Northern Railway. Northern Railway is coming up. It is doing very good work. A good number of surgery, good academics also there. Ambedkar ESI, Hindurai also some government ones. So these are chosen above these private institutes, private centers like set up aside, eye care and all. Haridhar said it will not matter at all. If you want to do a private setup, it doesn't matter at all if you're doing a DNB or private. Haryana, Rohtak, no doubt should be the first one to be chosen. Then after that, Kanpur is the one which residents have told me is coming up before ASI Faridabad. And there is a DNB in CH known as CH Rohtak. Exactly, I don't know the name. That will be the fourth one. Okay, so that is Haryana. It's like that. Because you have to go with the state counselling as well. That is, I am going state by state. Okay, in MP, quite surprising. Bhopal and Indore, better one is Rewa. So many residents have told me about this. I was a little skeptical about this because I thought that Bhopal and Indore must be better than, because being a center city. No, Rewa is doing very good in ophthalmology. So first choice should be Rewa, then Indore, Gwalior and Bhopal, followed by Jabalpur, Mandya, and this Chitrakoot Satragu. As I told you, this is a DMB, but has a very good surgical hand they give. So if you want to go with that, this Sadhguru Chitrakoot and Office Fellowship as well can be chosen. But academics are very less in that. Yeah, government job Fatih, I have told already, I have given that MSMD is preferred. Chhattisgarh, Raipur is the one, Medical College Raipur, then Bilaspur. This is in the sequence as told by residents. Rajnand Gaon and DO seat in Kanke should be the least one as told by a resident. Sanskriti, I just mentioned about that. So when I am over with this Sanskrit, just switch off, and then when it is uploaded in YouTube after 5-10 minutes, you see the recorded version, because I mentioned about this learning curve and investment and all. Okay, Uttar Pradesh, BHU, IMS should be the first one. Then Lucknow, Allahabad, I mentioned already. Lucknow, very good academics. Surgery is less. Allahabad, good number of surgical hands is given. Academics are less. So you have to choose what you want. Then Meerut is before Aligarh and Agra. Then Sitapur. Now this I would like to mention because it is giving a lot of surgeries today, and why students were not taking it, because they were not giving stipend. But I just talked to one of the residents over there who is currently, they said that they are giving stipend not equivalent to Lucknow. So this is a very potential, because it is a regional institute. Regional institutes of any state are having a good setup, and you can prefer that. In Sitapur, that's a RIO. So many patients are coming, so many surgeries are there. Academics are also becoming up. So that is one. I'm written it down the line because I didn't know, because students don't choose because of the stipend, because they are giving stipend now. It should be much higher. My personal thing, I think it should be equivalent to now Lucknow, Allahabad. So please think about that. Nobody will take that. If you take the Sitapur, I think you will not regret. Shreya Jindal is asking approximately how many years of fellowship does include to be recruited in private jobs. You can get a private job in one tier city even after 3 years, but that is a basic job. I started with that. But after fellowship, 3 years plus 2 years fellowship, you will get a job, and then you can just build on that. So 3 plus 2, 3 residency plus 2 years of fellowship. Uttarakhand, I got only one. Haldwani is a okay one, which, I mean, if you are in that state, you can take. In Bihar, Patna, then let's say Ranchi, Brahmpur. I will upload this list in my channel as well, in YouTube and in Telegram channel, or in the Instagram also I will post. Amritsar, Patiala, Faridkot for Punjab. Himachal, Shimla is better than Tanda. So there are some DNB institutes also, but if I am not mentioning them, it means those DNB institutes should be considered as peripheral institutes. Or you can ask me personally, what about them? Now Rajasthan, before Jaipur, Bikaner is the one which has been told by me, by the students, is doing better than SMS Jaipur. And not one, many residents have told me this. Then Kota, Ajmer, Jodhpur, Jharabad after that. Gujarat, Ahmedabad is in particularly one of the good ones in the entire India. So if you have a good rank overall, I'll just give you 6-7 colleges which are actually good all over India, like MAMC, one BHU, Sitapur, RAU Kolkata, Gujarat Ahmedabad, BMC Bangalore, WIMS Villari, Mysore, RAU Chennai. This is MS I'm talking about. Then Arvind hospitals, which I'll mention in Tamil Nadu. Arvind hospitals, in the sequence I'll give, which are the better ones. They are doing good in DNBs. I mean, these which I mentioned just now can be taken above many peripheral state institutes as well, like Arvind ones, like Shankar Netralaya, Shroff Charity. This can be chosen much above many peripherals. So in Gujarat, Ahmedabad and Bhavnagar, some have put Bhavnagar above Ahmedabad, but I think Ahmedabad should be above Bhavnagar. Then Rajkot, Surat, Baroda, Jamnagar. Dahod and Navsari are DNB institutes, can be taken lower down the line. In Maharashtra, sorry, Nair Hospital, Mumbai, I forgot in that list. Maharashtra was in my blind spot. So, of course, Nair is one of the ones which is equivalent to this, can be taken as equivalent to Shankar Netralaya because it's doing a good thing. It has been taking up for a very long time in the top 4 to 5,000. Topiwala National Medical Colleges, Mumbai. Then after that, say GS, KEM and Sion comes. Grant should be lower down the list because of various reasons. People are not taking grant. I will not answer them now, but grant is taken less. Then after Mumbai, Pune, then two colleges of Nagpur, IGMC and GMC. Then these institutes should be in the line in the Pune DNB ones. Dinanath, HV Desai and Jalna, Ganpati. Academics are less, but it gives a lot of surgeries. One of my friends is also there, does a lot of surgeries, a consultant over there. No, not there, but done from Jalna. Nandadeep in Solapur is a DNB, which is good in academics. And if you're not getting anywhere at your rank, you can choose Nandadeep. Nandadeep is a very good institute. In DNV, it is offering very less DNV seats now, but it takes care of the students. So please, I'm stressing on this point, Jalna and Nandadeep DNV can be chosen if you're not getting any MS which you like. Goa only one college. West Bengal, bond is one issue, but RAU Medical College Kolkata is a regional institute and that's one of the best institutes of ophthalmology. A lot of residents are there, but bond is the one issue. Then Neel Ratan Sarkar, SSKM Kolkata, Calcutta National Medical College is different from Medical College Kolkata. These two are different. So Medical College Kolkata is the RAU one. Then RGCAR, so many things are going on. Is lower down the list in the Kolkata. Shankar Netralaya Chennai is better than Shankar Netralaya Kolkata. But if you are getting Kolkata one, that is also still okay. So that's why I am putting it above the Burdwan and Midnapur. Many known, so a lot of patients are there in RI Kolkata. You talk to the residents, so many residents I know. You can message me on my number which I shared. I'll give you residents contact. You can ask them directly. Then Orissa Cuttack is not doubtly a good one, and it is actually a good Cuttack, and followed by Burla. Then DMV institutes are these IGH. I don't know the name, but it has been given by a resident. IGH Apollo High Tech. These are DNB institutes in the sequence. Guwahati, Dibrugarh in the northeast, Agartala, then later on in Tripura. RIMS in Imphal also comes before Agartala. Now Kerala colleges are quite good. Trivandrum is one of the good ones. It's a RIU there, followed by Thrissur and Kozhikode. Then the bold ones are the ones which are the top ones of the state. Little Flower and Comstock are those DNBs which can be taken if you are not getting anything in that state. Now here comes Tamil Nadu, because Tamil Nadu offers a lot of seats because Arvind Institute and Shankar Netralaya Chennai is based in that. So but if you are getting MMC Chennai, of course you should prefer that, because I told you already MS is better than DNB. But if you are getting a fellowship, if you are getting a DNB in a superlative, then you choose. But of course, if you are doing an MS from Chennai, and then you're getting a fellowship in Arvind, that is much better than doing a DNB from Arvind and a fellowship from Arvind. Okay, so think about that. So MS is better than DNB, and MS plus fellowship is better than DNB plus fellowship in that DNB. So this Shankaratralaya Chennai is the one which is a superlative institute. Then Arvind, this is the list: Coimbatore, then Chennai, then Pondicherry, Tirunelveli, Thani and Salem. So Arvind has so many branches, but this is the sequence as given by the residents who are already in Arvind right now: Coimbatore, Chennai, Pondicherry, Tirunelveli, Thani and Salem. And Shankaratralaya is different from Shankara Chennai. Shankara is a different, Shankaratralaya is a different one. Now Andhra Pradesh Osmania Institute is a very good institute. There is the RIU there, is a separate hospital, is doing a good job. Then Vishakhapatnam, Tirupati has been told in the sequence like this. And I mentioned already Bangalore and Mysore colleges are good. Even VIMS Billari, this Vijayanagar Institute of Medical Sciences is upcoming in ophthalmology, is doing good in surgeries, are giving better than some BMC, because BMC a lot of students are there, but academics are very good in Bangalore. In the 5-6 institutes in the India, I mentioned Bangalore because academics, I always prefer academics, and this is a very good institute for academics. And in Karnataka, Narayanatralaya, Netardhama are private institutes in DNB. If you do from them DNBs, chances of getting fellowships also are better, because see, a fellowship is offered by these institutes, and if you're doing DNB from them, they know you. A person who is doing MS from a peripheral will come for a fellowship in these institutes. So people know you already. So chances of yours getting a fellowship is much better than one who is coming from a peripheral institutes. But if you are MS from any institutes and you get a fellowship in these institutes, that is much better than DNB from this institute and DNB from and fellowship from that institutes that I already mentioned for you. So MS from anywhere plus a fellowship is much better than DNB plus fellowship because you have a mindset of that MS. But I've told you already, in general life there is no discrimination about MS and DNB. All right. Kajol is asking, MS from private colleges or diploma from AMU? I would prefer diploma from AMU and then secondary DNB rather than taking a private college. Karthik, yes, there are opportunities for research. PhD is there. PhD in any specialty is there, and after so much innovations are going on. So research and research fellowships are open all over the world. Clinical one is they don't. You have to go into the residency system of the country. I'll just tell you about the other countries also. Those who want to know, research options is open because if you do a research fellowship, then they can absorb you. Then they can. Then you can do a fellowship, and then you can be in that research program. But if you want to do any clinical thing in outside India, any country, you have to get into that residency program, and that is not an easy job. It's not difficult, but it's not an easy job. Like in US, you have to do MLE, do a residency again, then get into the system. If you're thinking that you do residency again here and do fellowship, and then you will be settled down in that country, no, that is not the case. If you do fellowship there, you have to come back to India. They will not allow you to practice unless and until you have a degrees like FRCS, FRC Opt. That is in some countries applicable, like Middle East, in UK, not Uttarakhand, of course, United Kingdom. Then FRCS, FRC Opt degree that can give you a job. But of course, if you want to get into the system, you have to get into residency. इंडिया में कम तो बड़ी मेहनत से हुआ है सब काम, वहां तुम्हें इजी मिल जाएगा क्या? ऐसे नहीं होता. इट्स डिफिकल्ट जॉब टू गेट इनटू देयर रेजिडेंसी सिस्टम. सो you can go and do fellowship there, but in the mindset that you should come back, or you have to do some these. See, FRCS and FRCO degrees you can give during the residency, but FRCS requires total 5 years of experience for the final step. There are various steps for this. So these are exams. There are various steps. Step 1, step 2, step 3, like that. So FRCS has various steps. Steps 1 and 2 you can start during the residency. But the final step 3, the Viva one, is after 5 years of your total experience, including 3 years of your residency plus extra 2 years. So don't think that even in you just given one exam and you will get this degree. FICO degree also has some steps. FICO offers only minimal observership for 2-3 months, but FRCS exam, FRC Opt exam can get you some jobs and good paying jobs in UK and Middle East. But if you want to get into some residency system, if you want to get into a system like you are in system in India, then residency is a must in that country, but that is not an easy job. That's not easy to get. Pratibha, DNB from peripheral private institute. Peripheral private institutes. Then why not MS? Why DNB from there? Arvind should be preferred over Shankara Kolkata Haridas. Okay, so I'll share up the list which I have made talking to the resident for each and every state. I'll refine it further. I'll talk to the residents, and 1 or 2 days I will give on Telegram page and various platforms. Anything else if you want to know? NEET PG is asking, my rate is 26k. Should I go for peripheral state or MS or DNB? Can I go to a good DNB? Okay, so that, see, will you get this DNBs? This has to be seen in the last years. In last year's counseling give you an idea at what rank it went. Like in Arvind hospitals went from 11,000 to 12,000, 13,000. So you have to see at your rank which was available to you. And I always say, those who have already contacted me, you see the last year's counseling. Even I told them to see the NEETMDS counseling session like we did just now. I asked him to see that. I asked him to see last year's counseling list and see the colleges, MS or DNB, whatever, available at their rank. Top 5, top 6. And then just WhatsApp me on my number or in my Telegram. Then I give them a voice message, or I type them what can be chosen after talking to the residents. This also you can do as well. Haridas Arvind Tirupati. I got Arvind this list from Tamil Nadu, Coimbatore, Chennai, Pondicherry, Tirunelveli, Thani, Salem. Now Tirupati in Andhra comes in what list? You just message me, I will ask them, because I got this list only in the sequence. I think that should be okay. And next, I think respiratory medicine is waiting to tell you about that subject. Diploma can be done in what type of colleges? Mostly in government colleges diploma is there. Like RIO Sitapur was a diploma, now it is converted into MS. Diploma is there in RIO Kolkata as well. 2 of my students have done there, and now they are getting 3 and 4th rank in the secondary DNB exam. Now they will start their secondary DNB. So if you are okay for secondary DNB 2 years, then only do DO, otherwise you don't, please. Alright, I think that will be all. Thanks for listening. Any messages, anything if you want to ask me, you can ask me on this, WhatsApp me on this number, or you can WhatsApp me, or you can Telegram me in my Telegram page. I will answer each and every one of you. It might take a little time, not 1 week. It will take 1 or 2 days, or maybe I'll try to answer today only. Now mostly I'll answer today because everyone mostly I've answered already. I'll try to answer as soon as possible. Thanks for listening. Best wishes.